Welcome to Mind and Fact. Here are 30 interesting facts about coronavirus and COVID-19. Fact 1. The term, new coronavirus, novel or nCoV, means that before neither scientists nor the cells met this virus before. Fact 2. CoV is short for coronavirus, coronavirus. This is the name of the family of viruses. There are about 40 of them, which bear resemblance with the solar corona due to the spinous crests. Fact 3. Coronaviruses are impostors from biology. The tailpiece of each spike imitates the molecule of a useful substance, so that the cellular receptors gladly pull it into themselves, and the whole virus is squeezed into the cell after the spike is in. This is how infection occurs. Fact 4. COVID-19 and SARS-CoV-2 are not the same thing. COVID-19 is a disease, D stands for disease caused by a new coronavirus. SARS-CoV-2 is the name of the virus itself. Fact 5. Over 2 million years of evolution, our immune system has learned to deal with most known infections, but the new coronavirus catches it by surprise. This is so hard to cope with and quite easy to get infected. Fact 6. Once in a cell, the virus seizes control over it and forces it to endlessly produce its own copies, instead of its usual proteins. A chain reaction begins. As a result, the cell dies, but the carrier of the infection becomes contagious. Fact 7. At the initial stage of infection, the new coronavirus actively reproduces itself in the throat and upper respiratory tract. Then the infection goes down and can reach the lungs, causing inflammation. Fact 8. That is why the first symptom of infection is a cough. Only then the temperature begins to rise. Fact 9. Or it does not begin. In 30% of patients in Wuhan, the temperature at the time of arrival at the hospital was normal. Fact 10. Many people who become infected, 18% or 1 in 5 people, do not even have a cough. The disease proceeds without any symptoms at all. A person may not even suspect that he is sick. Fact 11. Moreover, such an asymptomatic patient is still an active carrier of infection and can infect others. Fact 12. If COVID-19 proceeds benignantly, its symptoms are very similar to the usual seasonal flu: dry cough, fever, fatigue, sometimes muscle pain or headache. Fact 13. COVID-19 is also treated in the same way as regular flu, at home, symptomatically. Fact 14. One of the most unusual symptoms of coronavirus is the loss of a sense of taste and/or smell. Fact 15. Loss of a sense of taste and/or smell is not a common symptom, as does not necessarily happens in all COVID-19 cases, sometimes it is the only symptom. Fact 16. So if you suddenly stop smelling or tasting, this is a reason to grow suspicious and take measures. Fact 17. Important, the carrier of a new coronavirus becomes dangerous to others immediately after being infected, long before the first symptoms, if any. Fact 18. The good news, the more deadly a virus is, the worse it is spreading. By killing its master, the virus can no longer infect others. Therefore, the virus rarely mutates into a more deadly form, it is not in its interests. Fact 19. The bad news, SARS-CoV-2 is just from a different category. This virus makes its host a spreader, but it does not appear immediately or does not appear at all, so the carrier manages to infect several more people. Fact 20. On average, each carrier of a new coronavirus manages to infect 2 to 4 healthy people. This number is higher than seasonal flu, 1.3, but lower than measles, 12+. Fact 21. Although, like any infection, the SARS-CoV-2 coronavirus has the so-called superspreaders, carriers that infect incomparably more people, hundreds or even thousands. Fact 22. In South Korea, the virus was controlled until the number of cases reached 30. But the woman, codenamed Patient 31, immediately infected about 1,200 people. Fact 23. It turned out that she was very religious and continued visiting church, despite the cough and fever, ignoring the orders of the Korean authorities. Fact 24. Over 10 days, the number of infected in South Korea increased from 30 to 5,000. Fact 25. The mortality rate from COVID-19 is still difficult to calculate with accuracy, but most studies estimate it at 1 to 3%. Fact 26. This is about 20 times higher than seasonal flu, but falls short compared to the predecessors of the coronavirus SARS 10% and MERS 25%. Fact 27. Mortality from COVID-19 is highly dependent on the overall burden on the healthcare system and the rapidity of delivery medical care. In Germany it is only 0.3%, in Italy it is almost 9%. Fact 28. In the age group of 70 plus, mortality exceeds 5%, 80 plus, every 10th dies of the virus. Fact 29. That is why the main task of authorities around the world now is to stretch the epidemic for as long as possible, without allowing a large number of people to get COVID-19 at the same time. Fact 30. The pandemic is quickly developing, 100,000 patients 67 days after the first diagnosis, the second 100,000 became ill in 11 days, and the third, in 4 days.